want to welcome everybody. Great turnout. Great project for the region. If you're not aware of it, all our communities, this money was available for counties and for cities. And every county, Floyd, Montgomery, Pulaski, Giles, and the city of Radford, everyone came together on this and provided the match for it. Holly's going to talk in detail about that, so I'm not going to take that part away. But welcome everybody this morning, and good to see you all. And is this the biggest one that we?
Thank you. So far.
All right, guys, good job. All right, welcome. Good morning. And here's the important folks talking about the program.
Good morning, everybody. We did one in Pulaski yesterday. We had maybe half the turnout that we had here today, and those 2 hours flew by. And I know there's a lot of stuff that people wanted to say that maybe they didn't get a chance to say. So we're going to try to zip through this formality part here and get on to the discussion, because it's really what we want out of today's event is to get input, ideas, thoughts from you all about how to best utilize this money and how it might directly benefit Giles County. So before we jump into all that,
Chris
McClarney,
Yeah.
County Administrator. Good morning. So as we wait for lunch to arrive, lunch is on the way, let's just quickly go around and do a lightning round of introductions. Who you are, who you work for. Tammy, we'll start with you.
Tammy Mann with Giles County Victim Witness Program.
Bobby Lilly, Couples Attorney.
Mike Higgins, Giles County Resident.
Carol Allen, I'm the Children's Services Act Coordinator for Giles County.
Katie Stinnett, New River Health District.
Kristen Poe, River Hill District.
Lisa Palmer, Giles County Christian Mission and the Hope Board.
Jordan Brown, American Red Cross.
Helen Wallace, Giles Health Family Center.
Andy Williams, that also.
Chris McClarty, County.
Kristen Welch with New River Community Action Chip.
Stephanie Root with GYAP.
Brittany Jones, NRVCS.
April Shoemake, Community Health Center.
Cora Taylor, Chair of Giles Youth-Adult Partnership, Radford University.
Whitney Petrie, Community Health Center.
Justine Clifton, New River Valley Disability Resource Center.
Laura Grace Close, New River Valley Disability Resource Center.
I'm Roxy Todd. I'm a reporter with Radio IQ WBTF.
Boris Fleischer at Newport Mount Olivet Methodist Church.
Allison Patrick, Virginia Veteran and Family Support.
Deanna Williams, Consulting.
Stephanie Spencer, Corona Clinic.
Sherry Nipper Williams, Giles DSS.
Scott Moy, Giles Sheriff's Office.
Eric Twaits, Giles Sheriff's Office.
Chris Oliver, New River Health District.
Jeff Dinger County.
Ashley Hatch, Curling Clinic. Dee Frith, NRVCS.
Ann Getty, Giles Early Education Project.
Leah Wedgelick McFerrin, NRV Cares.
Sophie Ward, Women's Resource Center. Patty McComas Hall, Women's Resource Center.
Skylar, Giles County.
And Sarah,
Matt, you want to?
introduce yourself.
Matt, you mind saying who? Everyone knows who you are, right?
Matthew Shedd, Giles County.
And I'm Holly Lesko with New River Valley Regional Commission, Director of Community Health.
And I'm Mike Wade with New River Valley Community Services. There is a sign-in sheet going around. Please make sure that you sign that. I got to pass that on to our grant folks to make them happy and let them know that we fed you all lunch. All right, so you're getting a free lunch. The catch is we need your input. We need your ideas. We want you to share, speak up. There are microphones on the tables that you're sitting at. When you want to speak, if you have something to say or you have a question to ask, please just grab the microphone. You don't have to push any buttons. Just grab that microphone, because we are live streaming this event over the NRVCS YouTube channel. We'll also have a recording available after the live event ends. So, is that it?
Bathrooms?
Bathrooms, restrooms. There's one here. Are there others?
Down the hall, there's a men's
Okay,
room,
down the hallway. The important stuff, right? And food is coming courtesy of Subway in Pembroke. So it'll be here soon. Right, Cora? Okay. So again, this is really about an opportunity for you all to hear a little bit more about the Recovery Ecosystem project that's just recently been funded, and then to talk about specific strategies that we can work toward collectively in the areas of treatment, harm reduction, prevention and education, and recovery. Okay? And you all know the numbers. You know how bad this thing is that we're dealing with. It's affected all of us in some way, directly or indirectly. We all know people that have struggled with addiction, lost their lives to overdose. It affects us all. So we obviously do a lot of work, each of us in our own shops, to address the issue. But with a boost of funding like what we're getting through this Recovery Ecosystem project, it certainly can enhance what we're doing. It's not going to answer all of our problems because it is such a huge issue, but it is a step in the right direction. And I think it's important for us to engage our stakeholders, our community members, to make sure that we are, in fact, utilizing this money to the best of our ability. So that's why we're having this meeting today and in the other jurisdictions across the NRV over the next couple of weeks. Okay? So I'm going to turn it over to Holly now and let her talk a little bit about the project itself.
Okay, thanks, Mike. Everybody should have a sheet of this, so I'm not going to read through all of this. One of the things that I did want to share with you, as Jeff kind of indicated, is that this is funding. Some of you who have been around as long as me might remember tobacco money funding that came through. This is a little bit similar, where there have been lawsuits settled with drug manufacturers and pharmacies across the nation. And this funding is being directed out to communities that have been impacted by the opioid misuse and dumping, particularly in the Appalachian area. Some of this money is directly allocated to our counties and cities in Virginia. That's the way the state of Virginia has decided to do it. Every county and city in Virginia gets a direct allocation based on population, impact of opioids, and also their ability to allocate funding through resources in their community. Every one of our jurisdictions has gotten a direct allocation so far. There's still settlements coming, so we're not really sure what that total amount is going to be, but the state also held back competitive funding that we could apply for as collaborative projects. The New River Valley, in good New River Valley fashion, came together totally as a region and put all of their direct allocation money up as match to apply for a cooperative project, 5 years of funding in this region to pursue funding to address multiple, as you'll see, it's the laundry list, trying at least begin assessment as well as actual direct intervention around this need. We have 1.2 million in direct allocation that is going towards this funding, and I always get this number wrong, 2.1 million that will come to us competitively. We are still, in again, true, I guess, governmental fashion, negotiating how that funding will be distributed, but we hope within the next 30 to 60 days, that funding will begin to flow more directly in this area, and we have projects ready to roll, things like New Life Center, expanding beds at our treatment facilities. The New River Health District has a bus that was, again, cooperatively developed during the pandemic that has 2 exam rooms on it that we want to get on the road to start doing services, a myriad of services that have to do with opioid abatement, as well as what we know are the underlying impacts and causes of addiction, such as just basic health needs. I keep looking at my health district folks because it's going to be really important. And we need to meet people where they are, because some of those other underlying needs are things like transportation, supportive housing, food insecurity. All of those elements are things that we're going to be talking about and doing through this funding. Some of it's study, like we know that we need adolescent treatment care in this region. Lots of our kids, when they are caught up in addiction, get sent far away from their families, and then when they come back, maybe they've gotten treatment that they really needed, but there isn't services internally to help them. So we're going to be doing some looking at that. We're also looking at supportive housing. What are ways that we can address recovery housing when people are coming out of treatment as well? And a lot of money in prevention and the services that are already going on, such as our drug court, our recovery court here in Giles County, and some of the services that we know are needed for people as they're pursuing recovery in this field and in this need. I don't want to spend a ton of time talking about all of the specifics, because one of the reasons, as Mike said, we're here together is on August 30th. Our leadership team, which involves all of our local governments as well as the primary organizations that are going to be providing some of these services, will come together, and we're gathering information from you to share with them about where we think in Giles County, like yesterday in Pulaski County, talking in Floyd, Radford, and Montgomery, what are some of the specifics that are needed in those areas, and also what are some of the ways you want to be involved in this work? Because this work can't happen without all of us on board. We're all impacted, whether or not we're in recovery ourselves or know somebody specifically, because when we have a loss of anybody's contribution in our community, it's felt in our region. So I want you to be thinking about, Mike is going to help us guide us through some kind of areas like focusing on prevention for a limited amount of time, focusing on recovery. Also, we're going to talk about harm reduction a little bit. Dr. Bissell took the lead with that yesterday with us, and we're going to, these are all things that whether or not we're doing those things across the whole region, we need to be aware of the impact and the need for these services across the region. So with that,
Yeah.
I think we can just start our conversation because we want to hear from you.
Any initial thoughts before we get into specific categories? Or
Chris?
questions?
Chris, did you want to say anything specifically about Giles at this point? You want to hear too?
Got my own ideas, but I want to hear everyone else.
Yeah.
Fair enough. Anybody else with initial thoughts or questions? Okay, so we know that.
Yeah, go ahead.
Oh, I'm sorry.
I'm just extremely thankful that this came together with the regional approach, because one county can't do it alone. They're cross counties, but most of New River Valley, you might move from a county to a county or a town to a town, but you're still going to stay in the valley. And this approach is a game changer. Thank you.
We're in it together.
Thanks, Dee. Well, it's true. I mean, it goes back to what Holly said. There's no single agency or entity that can solve this problem. It really does take all of us. There's no, as I said yesterday, there's no silver bullet to fix this thing. So the solutions that we come up with in the communities are going to be unique to those individual communities, and we have to remember too that recovery, treatment, that path to recovery is unique to the individual. And what works for one person doesn't always work for the others. So we have to keep that in mind too. And the other thing is we want to avoid duplication of effort, not reinvent the wheel. Sometimes when you get a new wad of funding like this, you get excited and you want to roll up your sleeves and get started on stuff. And sometimes you have to pump the brakes, so to speak, and recognize the things that already exist, what's already going on, and not invest energy and time into things that are already in place. So we want to make sure, as part of these conversations, we're bringing that stuff to the forefront so we don't forget about things that are already happening, because there is a lot of good stuff happening. I mean, the trend has gotten worse. The prevalence of fentanyl has gotten a lot worse. We are fighting a multi-headed monster at this point, and we need all the tools in the arsenal that we have to address it. So let's just start with a discussion about things related to, let's start with prevention and education. Let's start there. So thoughts, ideas, suggestions, things that you're already aware of that we're doing in the realm of prevention and education awareness. And does everybody understand what we're talking about when we talk about prevention?
Come on, Cora.
Well, I mean, the biggest thing for me is adverse childhood experiences and trauma-informed care, because I think the more that people are aware of that, then the more that people have an understanding. I also think in a previous meeting, we were talking about stigma, like it helps people view it through a different lens. If it's not a moral failing, like things happened in childhood that led to this. I don't know, I've been in meetings with Mr. McClarney, like just about concern for our youth, and like the youth in our county are the second wave of the opioid epidemic. And until we address that and the awareness of that, I feel like it will continue to repeat itself. So the more people that have the education of trauma-informed care, and it's not about making excuses for behaviors, but it is about looking at things through a different lens. I was telling Holly, like just from an educator standpoint, I was at a training 2 weeks ago, one of the big things in a classroom, like for the teacher to have a classroom that's like calm and organized and like soft colors, because when kids who grow up in chaos walk in and the classroom looks like these tables back here, it just wreaks havoc in their brains and continues to thrive in that chaos. Like, it's really simple, basic things that can be done, and that, for me, that's where I'd like to see things start from a prevention education standpoint.
Absolutely. Getting to the root cause of a lot of this issue. You were going to say something?
Before I mentioned a little bit, a lot of times when we think about education, we're in public schools, but with the DOE's involvement in childcare now, I think we really need to recognize that education is starting at birth on. And one of the things that, and I help at a childcare facility here in Giles, and one of the things some of my staff has been struggling with recently is addiction babies don't necessarily act like regular babies. And that training, making sure that I'm able to find them that training on that you might need to hold this baby a little bit longer, and it might cry a little bit longer. And that's very important to recognize as well too, and provide. So if people have, if anyone here has training that they want to share with me, that I can share with my staff, please reach out to me, because teachers have different experiences too, so are our early childhood educators, and I think that needs to be recognized as a partner in some of the things that we're doing.
Thank you for sharing that. Let's remember to grab the microphones when you speak. This guy knows how to use a microphone.
Not sure if that's a compliment.
It is.
One of the things that I didn't realize the Commonwealth's attorney did until I started in this role was to participate in the Regional Child Fatality Review Team. And one of the trends that we have seen now for a decade is the high percentage of child fatalities that have substance use somewhere in the narrative, whether it's parents who were impaired and not properly supervising or properly providing care, or the kids being exposed. But there are already a lot of really good educational ideas and educational opportunities that are being pursued by the Department of Social Services because they are interacting with those families. So let's don't forget, in our focus on education and looking at the obvious issues of educating the kids, we're re-educating parents who are under stress because they're taking on new roles and have now undertaken responsibilities for additional little people, not just for themselves. So again, speaking about not reinventing the wheel, I think we do need to get a good idea of the overview of a lot of the educational pieces that DSS is already doing in those specific scenarios.
Yes, with DSS, we are focused a lot with the child fatality teams in, especially with substance abuse or use at all, and sleeping. We have so many, and they will go through child fatalities. I don't know how many last year, but I know one meeting we had, it was 4 child deaths due to co-sleeping, which had a substance use involved with that. So we're doing more pushing on letting parents know, given the risk of it, because especially out in our rural Virginia, everybody wants to sleep with their kids. It's great, but then we have been pushing more informational videos out, either in social media. I have one that's a pediatrician. He ended up killing his own child. And so there's certain things about it, just going to sleep to watch football. He was going to watch football. He wasn't going to fall asleep. But there's things about that. And then he talks about, then you add, that was just him not using substance. So we're trying to, and when you add that to it, there's more avenues. But we do have certain trainings that we're putting through on the Virginia State website to go through on different things of co-sleeping. And that is where they're heading more in our DSS realm with the substance use. But we have several different things that come through about trainings on that I can more willing share a lot. But that's a big focus because we deal with so many parents. And I say about 98% of our foster care cases are all substance use of some form. In the last, well, I couldn't tell you, since I've been around 20-some years, it's been that high. That's an inadequate supervision, substance use, or substance-exposed infants. It's several of those, and there is much difference in those. And I think when they do the foster care training, Helen, for our foster parents that have to deal with children that have been exposed at a young age, there are very different developments that happen and things. So I'll look and see if they have trainings offered to the public and find out where you can look at some of those. Because they're very helpful when you don't know. The problem is you usually don't know because people don't want to tell that.
And then also happens with the teachers. I think that's a big thing too, that the stigma, you know, that's something that happened to that child, and I need to help the teachers know that this is things that react. So a lot of education there for just us in general, not only parents, to help learn those things. And I'm going to shut up.
Just piggybacking on what Sherry just said, you know, as a representative of the faith communities and other folks here, I know have their own faith communities as well. So, you know, we're all gathered here and have these common interests for health and healing of folks in our community. And I think one thing that the greater community can learn perhaps as part of the greater prevention or treatment and long-term dealing with these things is the language we use. I hate to say it, but the church has often used the language of guilt and shame over the years that has unfortunately helped people remain in the cycle of addiction and abuse and whatnot. So I think we have to really help maybe dare I say older generations to know, look, we're living in a different world. We have to use different language, the way that we address this, that's not accusatory or condemning. You know, how can we be allies and advocates and helpers along the way? I think that's such an important part of being encouragers and helpers along the way out there in the trenches. And I think churches, we could do a better job of, you know, giving some tools to help us as clergy and as folks in our leadership positions in lay persons in our churches to really have these conversations in our Sunday schools and in our prayer groups or whatever and say, look, this is a really big issue. And it's a lot more than just saying stop doing it. It's a much more complicated thing than that. So I think we are looking maybe for, you know, language that will help us to do a better job of being an ally and being supportive.
The stigma around addiction is that it's a moral failing.
Yes.
So I think the faith-based community is a perfect natural place for us to really hone in on that.
Plug your event.
Yeah, oh yeah. Clergy Summit, August 31st, Belmont Christian Church, 8:30 to 12. Be there. If you know anybody that's connected to a congregation or a faith-based community. Ashley, you had the microphone, and then Penny, I'll get to you next.
Yeah, so just building off of what Morris said and kind of, I'm sorry, I don't know your name, but just when we talk about prevention and education in general, I think one of the ways that we can really do that is by not othering folks with the substance disorder, right? Because most people don't know, most new parents don't know that co-sleeping is an issue. That pediatrician who ended up with killing his own child, he wasn't under the influence of a substance. He was just really tired because he was a pediatrician, right? So we can provide those educational opportunities to everybody, and we're not othering a community. And I think that that's one of the biggest powerful things that we can do when we're providing this education is not othering a community, but providing that education to the entire community because it benefits us all, and we all need to know these things.
Penny, could you grab a microphone nearby?
Before
You don't
start,
have to push a button.
Just before I just wanted to let people know that the microphones are for recording on the video and stuff. It doesn't necessarily amplify your voice. So please still speak loudly as if you're speaking without a mic to the entire room. Thanks.
First, I apologize for coming in late. I had a meeting I had to go to, another meeting. But, you know, so I apologize if I'm covering ground that's been covered, but it seems to me that loneliness is a big factor in a lot of these problems. And I was thinking about how a lot of schools now have gay-straight alliances. Maybe they're being banned now, but, you know, I was thinking maybe there are ways that we could, as a community, come together to have something like a sober recovery alliance where you could have social events where people could hang out and you wouldn't necessarily, nobody would need to know who's in recovery and who's sober unless you wanted to tell somebody. It could just be like an event. You get together, you have a picnic or there's a movie showing and it's a chance for people to socialize. Because I know it's got to be very important for people in recovery to know other people in recovery, but maybe it's also helpful to know some people who haven't struggled with addiction where you can see, oh, this is what life looks like, you know, without having that struggle, you know, and where there is this de-stigma, right? Because, hey, people who don't have the struggle want to hang out with us. So I'm just wondering if maybe there's a way to schedule, and I think that could cover, I don't want to say kill two birds with one stone because it sounds bad, but, you know, I think loneliness is at the root of so many problems. And maybe there's an opportunity here to serve multiple needs. And I know when we were the thermal shelter, we used to have a community meal, like when our church would be responsible for the meal for the homeless. We'd sit down and eat with them and have conversations like normal people having dinner together. And I just think anything we could do like that might be something to think about.
Absolutely. I think it was the Surgeon General just maybe 6 months or a year ago that put out an advisory about the impact of social isolation on mental health, behavioral health in general, and obviously substance abuse is a part of that. So that's a great point, Penny.
We know it was all exacerbated during the pandemic, too, for all of
Absolutely.
us. So I think, again, to your point, Penny, all of us are seeking community connection. Doesn't matter. And all of us have our struggles with, the way that we cope. And some of our coping mechanisms are better than others. And so we all can be together and understanding with each other. There, as I said, normal's just a setting on the dryer. So let's just.
That's a good one. We had some ladies come in the back a few minutes late. Could you introduce yourselves for us real quick?
No pressure.
Sorry, I actually came from Tennessee, so I'm late, and I fought a storm all the way up 81, unfortunately.
You get a pass.
Thank you.
That's just because you were on 81.
I'm Christina Tyler, and I am with People Incorporated's Workforce Development Programs.
Good to be here.
Good to be here. I'm Angela Gentry, and I also work with People Inc. out of the Abingdon, Virginia office, and I'm working with
I also work for People Inc., previously worked for Goodwill. I am the New River Valley, we owe a career specialist, workforce development specialist. So if y'all need you guys holler at me, I'm doing my best to assist the community and the people around here that need help with professional advancement.
Okay, any other comments or thoughts around prevention education? Dee?
I don't have a microphone, but I do have a big mouth, so I hope they can hear me. I don't even remember who mentioned, I think Cora started it with the ACEs discussion and then the child care for the babies, and then we wrapped into education, and my head got to spinning about there's processes for kids who have disabilities, either a learning disability or a handicap or an allergy or something that gets filed with the school system, so they get an education plan that reflects the needs of that issue that they may be having, that they need special care for. Can that same thing apply to kids in addiction? Is that a thought? Is that something we could implement in the school systems to, if you're living in an addicted household or you're a substance use child, you were born with that medical condition or whatever, and I'm probably butchering all these terms and I apologize. It seems to me that if people in the school system are aware, there's better chances of opportunities in preventing the cycle from continuing, if that makes sense. So just a thought for the future as part of that prevention piece.
The stigma that is associated with that. So I think that it's a good thought, because the idea that is that there would only be well intent around that, right? But I think that could get really tricky. And I think instead that there would be, unfortunately, there is a lot of comorbidities that go along with it. And when I say that, I mean there is usually, when there is a child that's raised in a household with addiction, there is behavioral problems, and they might end up with an IEP anyway. And so I think that if I don't know that we would necessarily want to start labeling children as a child that comes with an addicted household. I think that gets really tricky because of the stigma. Until we solve the stigma problem, I don't know that we would want to start doing that. But I think it's a good thought. I think it's well intended. I just don't know that we're there yet. Does that make sense? The way I'm saying it? Yeah.
That's why I asked the question.
Yeah, I think to make you feel
as you mentioned, the word IEP, children who are born with addictive parents are already going to have these potential concerns, and they'll see that. And even in childcare, we have IEPs for babies, and as they graduate each educational component and are already in the school system with, I think that potential special education aspect might be there.
About the schools. Go ahead, Chris.
Already, just 30 minutes, is that this is a large problem that requires a very complex solution. And what we have determined in recovery court in just a few years that we've been doing this is that you got to heal mind, body, and spirit, and family around the individuals. And so it takes a network. And I think that's what we're trying to create here. So far, the ecosystem that we've discussed, and that was a great name, and Holly, I'm sure you're the one that came up with the name for this, but this ecosystem is comprised of many, many parts, and it's going to take everyone in the room and more to solve this problem. I think what's shocking is there's 100,000 people that die every year in America as a result of this. And when that happens, with anything else, there will be people lined up, legislators lined up, everybody wanting to throw money at it, let's fix this problem. But we are so far behind. I mean, here we are trying to create a network, and we're one of the only places in America even doing this at this point, right? I mean, this is new because it doesn't exist. A lot of people assume, you know, if we got law enforcement in the room today, somebody gets picked up on a drug charge, then there's somewhere to send that person for treatment. The answer is no, there's not. 9 out of 10 addicts never see treatment, any official or formalized type of treatment. So America is so far behind, right? And we're trying to recreate this thing. So the idea behind the ecosystem at this point is to establish an infrastructure with someone, an individual at the head of this who will oversee and make sure all these services are being delivered, not duplicated, but as efficiently as possible. And we make sure that people who have these issues are getting put into the right places. And that's one of the things we learned with Focus early on is there's so many of us trying to do good work, but we're in silos. And we silo ourselves, not intentionally, because we all got a lot of work to do. And so we don't have leadership, right? Right now there is a vacuum of leadership in the world of opioid and addiction. And so that's kind of the overarching theme of this whole grant at this point in terms of what communities are looking at is a way to develop this network that can address the problems. And you know, I'm hearing that today, and I love it. I think people all realize it. How do you solve the problem? Well, it's our hope that this money helps us to kick off solving these problems. In the past, it's been very difficult for someone like me to go to local government and say, we need to cut school funding so we can help treat addicts. No one wants to hear that, right? That's addicts. They made their own choices. That's, you know, but listen, that's not how it works. And it impacts our entire community from top to bottom. When we did the estimates for this opioid settlement, we estimated that Giles County alone, direct cost was over $35 million we spent on opioid addiction and basically incarceration, no treatment in that, just incarceration. So when you start considering numbers like that, it impacts us all at every level. So the idea here is let's develop this infrastructure, figure out how all these agencies can work together and get them the resources that they need out of this money to make the thing work. So I appreciate all of you coming out today and the comments you're making, because that's exactly what we hope to hear is, put me in, coach, right? I want to get in, but how do I get in and where do I get in? You don't even know who these people are, right? Police could probably tell you most of the addicts in Giles County because they've dealt with a whole lot of them. But as agencies, very few of us know who these individuals are. We don't know how to get to them. There's no means by which to communicate with them. And that's, to me, the problem that we've got to solve. These people it is our community, and that's what makes a community. So
I appreciate you sharing that, Chris. And I'll just say that, you know, this money's being funded by opioid settlement. Opioids are in the headlines. That's what's grabbing all the attention. Fentanyl kills people. But we have to understand, too, that the big umbrella of addiction is way bigger than that. So when we've got school officials telling me they're taking vape pens from 2nd and 3rd graders because they've already developed a nicotine addiction, it's big. It goes way beyond fentanyl and opioids. And we have to understand that as a community to truly address this issue. We're not just chasing opioids. We can get all the opioids off the streets, out of Giles County, and we're still going to have issues with addiction. So this starts at a very early time in the lives of our young people and continues on. They're impacted directly and indirectly just like the rest of us. And so we've got to recognize that. And it's not just opioids. Opioids is the gas in the engine right now because that's where all the money is. But it's way bigger than that. So we have to understand and recognize that. You don't have to push a button. You're good.
I just have a question. It seems to me that one of the big problems with a lot of efforts to do good is that people tend to come in and tell people, here's what we've decided will help you. And I'm just wondering if there aren't ways that we could ask people who are struggling themselves, what do you think would help you most? I mean, I just started about 6 months ago working as a volunteer librarian at the Dublin jail, and they tell me like 70% of these folks are in for drug-related offenses. And it's interesting what they're asking me for, which is like NA books, but also like, can I have books on yoga? Can I have books on meditation? So it seems to be the first place we should start really would be the community of people who are struggling and say, what do you want your community to provide that would help you stay sober? What do you think would be most effective to help you not fall into these problems in the first place? Maybe we start with the people who know the most about it.
Great point. And hopefully, as representatives of the agencies that we work for, we're getting some of that input that we can pass on. But I think having an opportunity for folks who are directly impacted by it to share and give their thoughts is important as well. Yes?
My quick statement is a lot of people maybe in homes of addiction and not with homes of addiction, just dysfunctional homes. People are not socialized to know how to navigate life in the best way. They're unaware that choices come with good and bad consequences. And because we're creatures of habit, we all are, no matter what habit we fell into. It's hard to help them develop the cognitive behavior change that allows them to walk out of it. So if you can't really show them a road to take other than the one they're used to traveling on, to get that relief or escape or whatever is causing them to self-medicate, it kind of leaves them at a loss and they don't know where to go and they get a defeat, which puts them back into that recidivism and that cycle they're trapped in order to be able to help them somehow. It would be best to be able to help them find another way to navigate life and teach them how to make that their new habit.
That's what I'm saying, like, cancer versus socialization.
Absolutely.
Habits or with addiction, they say, oh, here's some things you can do.
Absolutely. So it's a matter of maybe retraining, resetting the brain. I don't know exactly how you do it best, but that's one of the things that's the biggest challenge. Nobody taught him exactly.
Yeah, so just to add to that, you were talking about like community and asking them what they need. So like community mental health, like public work in people's homes for many, many years, truly life-changing work. If you've never done it, you should try it. Along with most of that table right there, who I'm sure you can go anywhere in Giles County right now and someone will walk up to them and be like, hey, thank you so much for what you did when you helped me. And so like, what I will say about that as a community is what I saw in doing that work is like some of it was really just basic needs. And like until we as a community step up and meet people where they're at and try to teach them basic needs, like and really help and guide and direct them, you won't see a lot of growth and a lot of change. When you talked about, Morris, about, you know, the language that we use, well, we offer recovery ally training. So like happy to set that up and come and do that for your congregation, like because it is about the language that we're using and how we're interacting with people. So I'll leave it at this and say that Mr. McClarney here, a few years ago, my brother was a participant in drug court and got pulled over going to pick up pizza one day for, I think, the river cleanup event. And it was actually miscommunication for once with my brother, but it is what it is. And Chris picked him up that day and just sat and talked with him all day. And what I will say about that is that, I'll get emotional, sorry, is that for my brother, for the county administrator to not treat him any different than who he was because of his addiction meant everything to him. So relationship is literally everything when it comes to helping people and trying to get them through the different side and just see life in a different way. And it's not always going to be easy. And you can't take it as a personal like failing when people relapse or fall back into use, but it is about like, how can we help you get back up? And that's why everybody in this room plays a part in that.
Yeah, we'll break for lunch. Maybe just start on this side of the room and work our way over.
Sandwich it.
Labeled on top what that they are, so you can grab it there, and this is the veggies too.
No, go ahead. Yeah, you. get
If
your
you have
lunch.
not-
There's lots left.
If you have not signed our sign-in sheet for today, raise your hand, please.
Ann, okay.
Ann has not signed the sign-in sheet. Anybody else that has not signed the sign-in sheet? You got it signed, Dee? Okay, okay. All right. So, one last word on prevention and education, and I'm going to give that to Whitney since she had her hand up before we broke for lunch. Whitney, take it away.
The Community Health Center of the New River Valley, and I manage our addiction and recovery treatment services. And so one of the things that we do offer is peer support services. Is everyone in here familiar with what peer support is? Yeah? Okay. I'm seeing lots of head nods. So we did a little bit of a needs assessment with our patients that we were already serving. And one of the things that they identified was the need for peer recovery specialists. So to be able to work with people that have had similar experiences as they're experiencing, and folks that have demonstrated recovery. So some of the skills, the tools that we're talking about in group and individual sessions, someone who has made those things work, right? Someone who can say like, hey, I've been in your shoes and here's what worked for me. So we started a peer program at the Community Health Center just about 2 years ago. And so part of what we do is our patients have access to our peers. They can meet with them in the office. They can meet with them out in the community. Our peers can meet them at Starbucks, at the grocery store, wherever that place may be. And then we also provide community engagement, so community events. So every quarter, our peers are hosting an event that is to promote some of that social engagement, to combat the social isolation and that shame and stigma. So that is something that we do in the community. Now, of course, we're really small, and a lot of folks don't know that we're here and that this is what we do. So we're going to do a better job of some outreach opportunities so we can continue to expand on those services.
As part of this program, too, as Chris was saying, the networking, I mean, if there's ways to leverage that work or if there's resources needed, I mean, there are pots of categories of funding, but a lot of the very specific ways that funding is going to be spent is not yet fully defined. So if there's things that would make a big difference if we had, XYZ here, these are things that we want to hear from. Again, as Mike said, we can't do everything in this first year, but we can't do anything if we don't know that there's a need. So if there's needs or specifics around some of these things that we need to be leveraging, please let us know. And I did want to let our two Virginia Tech folks who just came in a little bit late, if you don't mind introducing yourselves and maybe just, yeah. Mm-hmm.
My name is Julie Beck. I'm the navigator on the Overdose So here in community people, we actually just started the main study this month. We're getting pregnant people in the second to third trimester. And then it's a longitudinal study. Then we'll follow those people after. Would you like to? Yeah. We'll follow those people after from 5 to 10 years. So the children will be followed, and we will be doing a lot of firsts within that. So we'll be doing EEGs, MRIs, biomass, along with biosensors that will be used. But the most important part is we are going to support these people, those individuals. So if they have any inadequacies whatsoever, we're going to be there to help them. This study we're recruiting from Lynchburg to Lee County. So it's like 38 counties we have. We're just trying to make sure that it is all, spaced out and equally large, diverse of people. And we want to make sure that, they are supported in the most adequate ways possible. I mean, like, if they do not have transportation, I will physically come pick those people up and drive them to participate. But also, like, if they don't have diapers, we're going to make sure they have those things. We're going above and beyond in any way that we possibly can to help them. And these individuals that will be recruited, I mean, they can be in active use. And our hopes are that once we can get them into the study, we can help them get treatment. But they can also be in, in treatment themselves, or it could actually be someone with just like anxiety disorder, right, that is pregnant and is prescribed medications. So there's quite a large catchment there.
Cecil, nice to meet you, Cecil. Thank you, thank you.
Support is great.
Important. That's what we've
Yep.
just been saying.
Since this kind of bleeds over into the topic of treatment, we'll go ahead and talk about that specifically. So any thoughts, ideas, comments related to treatment that you want to talk about, or ideas, things that we need to do that we're not doing, things that are going well? Eric?
Microphone, maybe by Cora.
You wisely said, we're not trying to reinvent the wheel. But what are we going to do that's different? I've been at this since 1995. Started out with youth programs in the school, was a narcotics canine handler for 8 years, ran the drug task force for 8 years, became a supervisor. I've been involved in the narcotics issues in this region for half my adult life. Everyone is well-intentioned here, but what are we talking about doing that we haven't done for the last 30 years? Well, maybe we don't need to be afraid to try to reinvent the wheel or make it a better wheel. I don't know.
Let me ask you this. If you had a magic wand, if you could do one thing to change it.
There is not one thing. We're not just talking about culture, we're talking about, and I am all for this. I'm invested in recovery. I love our recovery court program. We needed it when I was in the narcotics program. There were people that I saw could have benefited from it, and they didn't, and they got tossed away. So I am invested in that. I don't want to sound harsh, but I also want to tell you the reality of what we're dealing with every day. I'm dealing with the grandchildren. Our schoolmates that have died, their children have died. I'm dealing with their grandkids now. You know them, good people. We play ball with them. How do you stop that? Where does it start? They're learning it from birth. So how do you cut that off? How do you remove that influence? That's got to be a consideration. And that sounds harsh. But they are training the next generation. I've seen it over and over again. That's a harsh reality that we have to own up to. I've stood over dozens of dead bodies. I've done CPR during COVID with a mother screaming, "Don't let her die." I've done that more than once. I'm sick of that. I don't want to see anywhere. So I do want a solution to this, but I also want people here to see the reality of what's going on in these homes every day. So don't be afraid to reinvent the wheel. I mean, I think we've got to look broader than that. There's a lot of these things that have been out for 30 years. I don't have the answer, Mike. I don't. But I do believe everyone's well-intentioned. But at some point, there's got to be an accountability to how do we stop, and I'm not saying breeding or it's hereditary. We know that that's part of it, but they're raised in it from the day they leave. And they're covered up in it. They deal with we have the same clients over and over again, and we're as frustrated as anyone. I don't know how it stops, Mike. But there's a lot of good intentions, but we do need to try something different, tweak something.
I'll give you one quick anecdote, just kind of follow up on that. NRVCS has clinicians who work within the juvenile detention center in Christiansburg, and I spoke with one of them a few years ago. They had a young man that had been in that facility for an extended period of time, and substance use was one of the problems that he was dealing with. He kind of got on the right track, was in recovery, healthy, doing better, was nearing his release. He broke down in tears, sobbing about the aspect of leaving and going back to the home because he knew he couldn't be safe. So what Eric's speaking to is, it's real.
There's a lot of, their hands are tied on so much.
Yeah.
And they work themselves to death, but that's the reality. You'll do this or do this, and you send them right back to the environment with the same people who made them what they are. And part of it's survival. They're going right back into that group. How do you stop them? Like, I don't know. And when they do these removals, everything is set for them to send them right back into that family.
I wish I had the answer.
I know, and I know you don't. I'm not expecting one. It's just that's just a reality that I think needs. Yeah. That's the ugly truth that I think we need to face.
Yeah. Well, you're in the trenches. You see it, Jeff.
Eric, I love the passion, and I know it's real. I love it. So much of what we deal with, and I'm looking around the room, what a spectrum of
organizations and individuals touching so many aspects of the human condition. Much of what we do is related to inherent poverty, generational poverty. And we've got workforce development. That's a key. We've got early childhood education. We've got reintegration. We've got literacy. We've got the faith community. We've got medical care. I'm looking around the room. We've got judicial. We've got transport. We know that's always an issue. This is what we need to do. We need to make sure these people are always in the room and always talking to each other. So we know what we can do with someone who needs help. And it's never one issue, is it? Ever. So communication amongst ourselves. This area is just mind-boggling, in my opinion, for the networking that we're able to affect here. And can we be better? We can be better. But we're on the right track. That's what we have to do. We have to work together to network and make sure that those who are in need get all the different spectrum of services they require to be successful in the world. Break that cycle.
So I love what you said. I do, but I also agree with what Mike said with not reinventing the wheel. And it's a both and. So what I think a lot of what we've been doing so far is all that we had the ability to do. And it's a concept called like up the river, down the river, right? And so all we could do so far was save the people down the river, right? All we could do is pull the people out of the river after they had been in the river drowning, right? That's all we could do. And we need to keep doing that. We need to keep pulling those people out of the river. We need to keep saving them. And we need to expand those services because we're not saving everybody, right? Right. Exactly. Exactly. And I heard that. And I heard that from you. But now, with the ability, and as we have everybody coming together as a region and have more resources, not only should we expand the pulling the people out of the river, but let's go up the river, figure out how do we keep people from getting thrown in the river. Yeah, and I think that we have the ability to do that with what we're doing now. And that's, I think, the point of these conversations. And so, yes, it's a both and.
We did not mean it as a ridicule.
Right.
We're all fighting the same thing, in the same bureaucracy.
Right.
At some point. They're only allowed to do what the law allows them. You know, us in social services, we work together a lot, and we have the same problem. So I didn't want you to think I was ridiculing anyone. It's a frustration, but I also wanted to speak of the harsh reality that some people in this room may not understand.
Right. And it's the system, right? It's the system that is making the people end up in the river and they're drowning. But the most important the most important thing right now has been, let's get the people out of the river. But now, since we can have some more breathing room with the expansion of this funding, and we're all coming together, now more people can go up and let's fix the system, hopefully.
And maybe that's what I was talking about, how you get them out of the river.
We have to figure that out.
Right, that's what I'm saying.
Cora's got it all figured out.
She's got it, yeah, go ahead.
Community member. So taking my role as a nonprofit out, the faces that I see here are governmental or nonprofit. Some of the things that I'm excited about seeing on Facebook as a parent are, American Heritage Girls or Boy Scouts or FCA. Are those organizations eligible for funding, or do they just need to be encouraged to attend this type of meeting? Because that is something that I see. We're talking about how to keep our kids forward down the road and not getting in the river. And these organizations are something that I see that, but how do we support them? Because I'm all excited about August 14th. My little girl can go to the American Heritage Girl meeting and learn about this new program. And I got a van. I'll bring more little girls, kind of thing. How can we encourage those type of organizations to be part of this process?
Certainly that can be a piece of, and I think particularly when we're talking about prevention and some of those other activities, the underlying kind of, maybe to Ashley's point, I'm sure Cora will speak to, like some of the needs that we know are not being addressed because there isn't access to things. One of the things Chris McLaren and I were talking about before he left was, you can't know what you don't know. So how do we help people, know that there are other options, know that there's opportunities for their kids and stuff, and also what are the resources that are missing for people to have access to those opportunities? Because maybe American Heritage is the right thing for, 25% of these kids, and then we need something else for some other group. I want to get on the river. I want to be in the river, but in a healthy way, in my kayak or whatever. So I'm I do think we have to have those conversations about what are the things that we think could be alternatives that would be ways, because frankly, the reason our species has survived as long is because we are pleasure seeking and pain avoiding. It's how we've survived for a really long time. And so what are the things that we can do in a healthy way to continue to survive in a productive opportunities that we currently don't have, or that we want to make sure people are aware of in stronger, better ways.
And I think the kind of thing that you're bringing up is great. It is promotion of protective factors.
Yeah.
Which is a great strategy for prevention.
And recovery.
I've talked too much. So yeah, being able to promote those kind of groups, get those out there, exposing young people more to those opportunities, whether it's a civic group, a service organization, a faith-based community, whatever the case may be, to let them know that there are supportive, caring adults that they can look up to and bond with and connect with that can hopefully offset some of the negativity of what they see
And modeling
in
for
their
their
home.
parents too, of what
Absolutely.
that looks like.
Absolutely.
Because the parents might not know either.
Yeah.
We just
Yeah.
none of us want to raise our kids badly, I don't think.
So promotion of protective factors and reduction of risk factors, that's
They're
a,
going to let Cora, and then.
Like, I think you are spot on with that, but I think that takes everybody in this room to do that. I mean, I know, like, years ago when I was doing community case management, like, worked with a mom who had a little boy that wanted to play rec basketball. By the way, I had a caseload of 22 in Giles County at one time. 2 had a driver's license of all the moms I worked with, okay? 2 out of 22. So we expect people to do things, and we expect them to show up at DSS for their appointments, and we expect them, but they don't go. And then it's easy to sit back and say, well, there's Medicaid transportation. Well, that's not easy for someone to get in a car with someone when they were sexually abused as a child by their uncle, so they don't want to get in a car with somebody that they don't know who they are. And that, to me, is why trauma-informed care is so important, because then you start to look at things through that lens of, like, maybe that's why they don't do that. But, like, I also think, like, I worked with Sherry for a really long time. Like, when I was working in special deliveries, like, I needed their accountability. Like, I needed that accountability for the clients I was working with, because sometimes they needed that. But what I also know is that a lot of times my clients looked really defiant. Well, guess what? That's a trauma trigger. So, like, when you know that, then you start to, like, try to build the relationship in a different way. So, I mean, I love the world of law enforcement, but, like, I've been preaching trauma-informed care to my husband for 7, 8 years, and, like, I can tell you now that he's in the school system, Josh Taylor looks at trauma-informed care a little different than he used to, because he's working with the kids. And, like, you have a little more empathy for kids than you do adults that you're, like, tired of dealing with, because it's the same thing over and over again. But you're right, it is generational. And I know, statistically speaking, kids that end up in foster care, like, I think 50% at a minimum continue down the same path, even if you put them in the best home that you could possibly put them in, because it comes down to identity, and kids feel rejected regardless of the circumstances and how loving the household that they may be in. But that's why, to me, it's so important for people. And I know Holly and I have been talking about, like, for my work at Radford, like, how do we get the student athletes in the school system to, like, give these kids somebody else to be like, oh, there's hope. Like, my life can look different than what it looks like at home. Because, like, yeah, I can tell you, we got a lot of families living in some real poverty here and some really, really hard situations. And it's not an easy fix, but it's going to take everybody.
Okay, yeah.
Andy?
Yeah, sorry.
And it's
Sorry.
amazing
That's
how
a lot of people.
issues that come back to transportation. And a lot of the issues are transportation related, whether it's drug court, and we have trouble having drivers. A lot of our vans are limited usage. Trying to find a driver that will drive in the evening consistently. So that's an obstacle. And driving, like Corb was talking about, trying to find somebody, whether it's a Medicaid trip or it's not a Medicaid trip, who's going to pay for it. We apply for every grant we can find, to help supplement what we do as a nonprofit to help. But there are so many issues related to driving. Employment. We get this, folks, when we take people to methadone. We fully support methadone clinic to try to keep these folks off the hard stuff. We could triple how many people we take because the need is huge. And for the few that eventually get off of it, and it is few, and to improve their lifestyle and support them. And, we have what we think is a success story. We have one young man who rode consistently methadone, had community service hours he wanted to do. We let him do it at our facility. He's now our cook, and he's working for us. We're paying him. Worked with workforce development to get him hired, and he's done great. And so that's one. Don't know of any others that have gotten a job or gotten out of that system of getting up at 5:30, going to the clinic, and then going back to bed, because that's what most of them do. But we support that. But the transportation issue is just huge, and I'm sure you all see an issue with transportation in what you do. So that's something we've scraped for funding for, everything we do. We try to get funding for different elements of transportation.
Why can't we get a place in Giles County where they don't have to go over the mountain every day?
I can promise you don't want a methadone in Giles County.
I don't know if that's not our question.
Right.
One of the triggers, or one of the things that everybody says, they have to go over the mountain every day. And I know they'll come to the mission, they'll actually stand outside and wait for the ride.
Yeah, I don't know if you would want the clinic in Giles.
And I do want to thank everybody for being part of that feasibility study. I apologize, I'm talking about prevention. But if you're in this classroom, or it's my educational aspect, you're familiar with the feasibility study we're doing. So thank you for being part of that. If you're not, come and talk to Jeff, Andy, or myself to try to get some more transportation options in Giles. But that is a big component where we are bringing children to daycare. We are bringing moms to get their fingerprints so they can become teachers. Transportation is a huge, huge issue, and I think it's not going to end today, but it's more on that preventative side. And I know we're trying to talk about treatment, recovery, and harm reduction, but it's all intermingled. I don't know how we separate those two components, but
Access to treatment is incredibly important. Whitney?
Here that we don't want a methadone clinic, here in our area, but the folks that are utilizing those services are already here. That's already the population that we're seeing and we're living amongst and working with. And, the CDC, according to the CDC and the World Health Organization, medication-assisted treatment is the gold standard for opioid use disorder. And so medications like methadone, medications like buprenorphine, medications like Vivitrol, folks are getting engaged in treatment through programs like this. And so, maybe, because that's part of what we do at the community health center, so maybe they got on the schedule to meet with one of our waivered providers to start Suboxone treatment. Now, guess what? A year later, they're not only involved in their Suboxone treatment, we're working through their mental health diagnoses. They're meeting with our care coordination team to address those needs in the community. They have found stable housing. They've gotten their license back. We have folks who have demonstrated time in recovery with Suboxone treatment and are now peer recovery specialists themselves and working out in the community and just spreading that. So, that's a form of harm reduction, and those folks are already here. And so if we can make things more accessible, treatment more accessible, because that's what we're talking about, treatment for the entire family, we have to treat the parents.
Your agency, our agency are both already providing medication-assisted treatment. I guess, Andy, to your point, there are certain facilities, programs in our region, and we know who they are without saying names, that have maybe developed a bad reputation because of some management issues in the way they operate. And I think that's put a black eye on medication-assisted treatment. I think we have to see past that. I think we have to recognize that this is a viable form of treatment and recovery for folks who need it. It doesn't work for everybody, and not everybody's on it the same amount of time.
And we fully support and go out of our way anytime we get somebody from the county. We pick up people in Pulaski, Bradford, Montgomery that need to go.
Yeah.
Fully support that program.
It shouldn't be standalone. That's, I think, your point too. We know that there's wraparound services that should be part of that
Yeah.
to help people in recovery, whatever that recovery path looks like for them. I know you've been waiting for a second.
That's fine. One of the things we learned early on with our recovery court program, something that everybody in this room already knows, but it's a big lesson for our participants when they realize when they've tried to stop on their own and someone has just said, just stop that bad habit, the piece that's been missing is they've not been told how to replace that bad habit with something else. And I think that goes back to the point that was made a little bit ago about Scouts, Heritage Girls, some of these other programs. They do play an important role in what we do because it is the important first step in being able to replace these habits with more pro-social activities. It also ties back to the point that somebody made over an hour ago about finding the social outlets that don't carry the stigma of being a recovery event, just being able to find the group of people, just being able to find the activity, just being able to find the social engagement to go out and participate with other folks who may or may not be on recovery paths of their own. One of the ways that we have seen that, and I greatly appreciate the county and other folks from NRVCS who have really stepped up and helped us expand what we're doing with our recovery court program. About 2 years into drug court, one of our participants said, you keep telling us not to focus on drugs, but I have obligations with our drug court on a daily basis, and I'm forced to say the words drug court multiple times a day. So we started referring to it as recovery court in-house. The fitness component was something that nobody else was doing. And I think we have been true leaders here in the county in our recovery fitness program. And what we're finding is that our participants who are required to be involved in this physical fitness component every Wednesday, and then they have an optional Mondays that they can come sort of as a free gym or do yoga or nutrition advice or whatever. Some of those participants are bringing their kids. Some of those participants are bringing a spouse. And that, I know, is something that's already on your all's radar and we have benefited from funding, and I know there's discussion already ongoing about how to expand that program. But one of the ways that I think we really ought to focus on the expansion is not just by enrolling more people in our recovery court, but how we expand those services to their family members, to their neighbors, to their friends who may not be involved in a formal structured recovery program run through the court system, but are trying to stay sober themselves. So that's an area of expansion that I don't know anybody's actually specifically articulated yet.
I think all that goes back to what Cora was saying earlier, though, about relationships. I love the fitness program through the recovery court, but it's not about barbells. It's not. It's about the people.
No, it's about the fact that you can drive through the Democratic Circle on Wednesday night and you see Judge Harrell and Christopher running around the courthouse. Like it makes me cry like every week. That's just huge to me.
Yeah.
Like that they do that. Like they're part of it. It's not just
They're invested.
they are. It's not just how you go work out. It's like, no, I'm doing it with you. Like I'm right here in the trench with you, and we're doing this together.
Ashley?
So I'm shifting the conversation a little bit, but so one of the difficulties I know that we experience as an organization, and I'm from Carilion Clinic, and it's kind of all tied together, but there's some different levels to it. So as far as our peer support specialist program, but also in providing just keeping enough providers for behavioral health services. And so I'd be interested to know how this funding could help expand or your community health program, right? So if they are trained LCSWs or whatever they are doing community health in the homes of people. I'd be interested in looking at like different tiers and like triaging different folks and what that looks like and how is it that because the bottom line is we don't have enough providers. And so one, how do we deal with our provider shortage? Is there a way that we can triage care? And then, or just, is there places in this with this funding to help with that? Because I know as our organization, we just are not able to attract and retain enough behavioral health providers. And then the peer recovery specialist position, wonderful, needed, skilled position, not enough to provide for a family. So how do we fix that? Is that a pathway to career growth that's provided through other organizations? Okay, maybe we already have a solution, but I don't know. I would like to see that. Like, how do we deal with this provider shortage of mental health providers overall at all of the levels? Because I think that we need it at all of the different levels. And that's a huge conversation, and not that we're answering it here, but that's something that I would really like to see this funding help deal with.
Workforce has been impacted just like law enforcement, schools, any other entity.
Medical health.
Yeah. You're on.
I don't have a whole lot of answers, but I do have the answer for the peer recovery specialist. With the skill, my program offers support to get that tuition and other supportive services for them to be able to get that skilled certification. But, they get the training. They have to get a certain amount of applied hours before they have any type of certification in the first place. But, and there's continuing education components. But in order for people, if they are clean for the amount of time that they need to and they are serious about that passion, we can help with the training so they can. And I had peer recovery specialists, I'll just be transparent, training, and it was free to me. There are opportunities for people to get that. It's just a matter of knowing who to network with. And that's what I was going to say earlier, and everybody else said it, but I'll just echo that unity and the multidisciplinary approach is evidence-based practice that shows that that's what it takes. This is what it takes to make a difference, the unity within us and having a like mind to come against it. There's power in our numbers.
Before we run out of time, I do want to jump over to harm reduction. We can't overlook harm reduction.
Nope.
Okay? Everybody understand what we're talking about when we're talking about harm reduction? Everybody get that? Okay. So one form of that is naloxone, Narcan distribution, making sure people in the community have that, using that to reverse overdose. That's one aspect of it. The one elephant in the room that some people don't want to talk about, for obvious reasons, is needle exchange, syringe exchange. Those programs are happening in other parts of Southwest Virginia, but we don't have that currently in the New River Valley. That scares a lot of people, and I get it. And there are people who have reservations, concerns about that because they think that we're basically just giving the green light for people to continue to use. But what really matters are the public health ramifications of not providing that service, that support for folks who are actively using. They're going to use regardless. So let's make sure that they have clean supplies when they use intravenously, because the hepatitis C, HIV, Hep B rates in our community in this part of the world are mind-blowing.
Does anybody know how long hepatitis can last on a surface at room temperature? It's like crazy long. It's like 30, it's like days. It's like 30 days.
It's weeks. It's weeks.
Weeks. Weeks, guys. Okay, I'm sorry. When I learned that, I was like mind blown. Anyway, just thought I'd share that.
So it's a thing.
Of open it up to the community of people like us that say it's okay to have a methadone clinic in our community, or it's okay to have needle exchange. So the community could come in with their concerns because I think you hit it when you said a black eye, because I have drivers that won't go to the methadone clinic because they're scared. And how do we change that perception? Because I know it's been repeated several times of it's, I mean, we all probably can raise our hand and say we have this affecting our personal family. But there's still that stigma. Would any type of community discussion, hey, we're all going to be here at the rescue squad, and you've got law enforcement, transportation, you know, a methadone advocate here to answer questions, to help provide some of that Q&A and opportunity to have that fear reduction occur.
Yeah. Well, I like that idea. I think, well, it reminds me of a saying about opinions that my late mother had, but I won't repeat that here. I think for the most part, even people that are accepting and understanding of treatment, recovery, harm reduction, they wouldn't want it in their backyard. Bottom line. So they're not there yet, and it's the stigma. But we wouldn't want people with diabetes that need to take insulin using dirty products, would we? That could cause a risk to their health. I mean, it's the same thing. If we truly understand addiction to be a disease and not a moral failing or bad people doing bad things, but they're living with the disease of the brain, then we treat it just like we do any other health condition that requires medication, treatment, therapy, whatever the case may be. We got to get past that. We got to get over that hump.
And to your point, I mean, just also, we need to hear the stories from people who are, you know, who are living this too. And one of the things that we're doing as part of this program is doing some anti-stigma campaign. I don't know, hopefully it'll have a better name than that. I don't know, I'm not the guru around those kinds of things. But the idea is we're all swimming in the soup. And so we should understand what that soup looks like, how I can protect, you know, there are risks that I try to avoid in my life too, and I need to understand those. But there are also risks that each individual has a different risk understanding. And so trying to be clear about what that is and understanding stories from individuals, because it's how we connect. I mean, we can talk about the statistics. I can have somebody who runs a methadone clinic. I mean, but hearing from somebody who's lived it and walked it and is willing to share it with us, I think is one of the ways that we can learn together as a community about how we can support this. And also, I do think there are going to be opportunities, lots of opportunities for us to form some what we're calling technical teams around this. So there are things around transportation. There are things around, you know, treatment. There's going to be a lot of things around anti-stigma work that we're going to be doing that we hope, again, multiple people from multiple backgrounds will come together along with people with lots and lots of expertise, that there's space for us all to be part of this conversation. And some people aren't going to be there with us. Some people aren't, and we're gonna keep having the conversation and keep inviting people to the conversation until we all feel a part of the solution versus pushing the solution away, or the problem away from me. Sorry, Cora, yeah.
Like, as far as harm reduction, I mean, when we talk about like Narcan training and things like that, like I know, I think we've come a long way with that, but like I've reached a point, like I want my 15-year-old carrying Narcan, because when the kid next to her on the bus going to a volleyball game gets a bad gummy, and like I want her to be able to save them, like at the end of the day, because sometimes, and that's the bigger thing that we have to understand as a community, is our kids like are getting stuff that's not good, and they don't know, like they're not intentionally sometimes even doing that. It's like, oh, I'm just gonna smoke a little weed. Well, the weed that our kids are smoking, not the weed we were smoking, okay? Like, you know, like it's got fentanyl in it, so like it's totally different. Needle exchange, like I'll just tell you, like it makes me uncomfortable. Like it does make me uncomfortable, but I also know that like if you had church members running that like are just talking to people and just loving them and meeting them where they're at, like needle exchange programs have actually proven to be that people end up getting into treatment through a needle exchange program because they develop a relationship with people that are there, and the people that are there know where the resources are at. So, I mean, even though I don't love it, like there's effectiveness to it. So we just have to be open-minded.
Waiting, yeah. Sorry.
My question is, how much time and energy, information has been gathered from success stories? Because I have 3 of them that I work with every day, and I'm so proud of them. They have done so well for themselves, and I would love
for them to be able to share their stories if they would like to, and go from there. Say, hey, what did you do to get yourself up out of this? And it caused, she almost died, and she prayed, and she said, God, if you let me live, I'm done. And she was, and she lived. And I gave her a chance. And, you know, I think those are some that we need to go to. You guys may already have, but I would love to just, you know, ask them, how'd you get through it?
These are the stories we need. We need to gather all the stories, and that's definitely part of it. Yeah.
Treatment and harm reduction.
And recovery and prevention.
And everything. I visited one of our facilities in the Brunswick Community Corrections Alternative Program, which is probationers that are behind bars. They're on probation technically, but they're actually in a facility with barbed wire, the whole 9 yards. They're in a minimum security facility. They go out in the community and work, that kind of thing. One of the things that they are doing, because they're doing medicated assisted treatment, they were doing Suboxone strips. Now, in prison, Suboxone treatment is you go to the nurse, you stick it on your tongue, you have to hold it in your mouth, you got to go sit in a chair for 15 minutes for the security officer to look at you and look in your mouth and make sure that the Suboxone strip is gone. They will find a way to subvert that. You go to the clinics, they're going to give you a script. You can use them all at once when you leave. Okay, so what we have done in a secure facility, we have gone to the 30-day shot. Somebody came up with a magic shot that you take it once. It does a time release lapse over 30 days. So if we had some sort of clinic that did that along with peer support recovery, and you had a nurse came in once a month and gave shots, much better than the other, because you're not taking anything with you. You don't have a way to subvert it. It's expensive, but in the long run, it's actually more cost effective.
Yeah.
So
I think part of our problem is in this whole issue is in treatment, recovery, harm reduction, we can't keep pace with the evolution of things from the sellers, the manufacturers, the people that are putting it out there. Yeah. I think we're lagging behind significantly. And they're always changing, evolving, and we just can't keep pace with it. So we're always pulling up the rear end.
I was wondering, so thinking about disease spread, right, and harm reduction, is there any evidence for needle collection, as a part of harm reduction? Like, if people aren't on board for needle exchange yet, is there evidence for that part, to take a step towards it, right? Needle collection and disposal in order to get some, to start with it? Or is there evidence to any? I'm not as.
Yeah.
Yeah.
So I'm the bad guy in the room. I've been giving out clean syringes for about 2 years now. And, so I've worked in harm reduction in Smith County, and in Roanoke City, Martinsville City, Henry County, Franklin County, Patrick County. There are people from Giles County who come get syringes from us. There are people from Giles County who come and get snorting kits, smoking kits, and all those kinds of things too. And it is, the one in Smith County was a 1-to-1 exchange, so whatever they brought back is what we would give them. If they brought back 100, we give them 100. And that's a month's supply. 120 was a month's supply. Roanoke's not that way. If they bring back some, we'll give them an extra bag of clean syringes. You know, the syringes get a lot of hate, and a lot of people do not want to get on board with it. They don't, I've heard enabling so many times. I've heard that it's just going to bring more people into our community that's using drugs, and it's going to steal and do all these things, and it's just not the case. What happens in harm reduction is the syringes, and this is top secret information, the syringes are just a way for them to come and see us. It's an incentive. They don't know that, but we know that, right? And it keeps them safe. It keeps them from sharing needles. The hepatitis C rates in the New River Valley have skyrocketed the last 2 years. I mean skyrocketed, right? Harm reduction is, my definition is radical love with safe options, safe choices, because it is radical. And if we're talking about reinventing the wheel versus not reinventing the wheel, like this is reinventing the wheel, because what we've been doing since the war on drugs hasn't been working. It's just not. 110,000 died in 2022, most ever recorded in history. That's just from overdoses, not even drug-related deaths. 75% of that was fentanyl, obviously. There's another drug called xylazine coming around. I have xylazine test strips. I have fentanyl test strips. And I give those to these people that are using drugs, saying test your product because you don't know anymore, right? So there's all these options. And I'm not saying, I'm not coming here to say we're bringing this to Giles County. This is how it is. This is a feel of what the communities need at this point, right? The change in language and the trauma-informed care, I think, should be the first thing. Because if you're going to understand harm reduction, you really got to become not only trauma-aware, but trauma-informed and what that really, really means. Because even Giles County has experienced community trauma. That's kind of what got you here. The Oxycontin thing from Big Pharma is what kind of got you here, right? So it's going to take a lot of education. And whatever your team you're on, as long as it's coming from a place of love and compassion, then it's fine. Right, whether it's law enforcement, because now we expect law enforcement to be mental health counselors. That's never going to work. I promise you that's not going to work, right? Well, I used to train CIT. I used to be a trainer for CIT, which is Crisis Intervention Team for law enforcement. And I heard the hug a thug and all these things. But, the reality is, and what I've seen from it, like these are still human beings, right? And these are still people's sons and daughters and moms and dads. And it doesn't really matter to me what they do with the syringes or what they do with the pipes I give them. All I care is that we're connecting for that moment, right? And they feel safe in that moment. And then they're much more likely to make better decisions about their life when they've got the support and the connection and the love. And if you get that on a community level, then Giles County will be exactly what you want it to be at some point, maybe not in our generation, but who knows?
Thank you, Chris. Any final thoughts? We're just about out of time. So I've used this phrase a lot when I do naloxone training for community members. I think it's just important for us to remember that the path to recovery does not run through the morgue. So until we have people ready to accept professional help and get treatment and enter recovery, we've got to keep them alive. We've got to keep them as safe as we can. So whatever that takes. And we all have a role in that, in keeping people safe, keeping them around, leading them to eventually find a place in their lives where they're ready to seek help. We don't ostracize or make fun of people with high blood pressure or high cholesterol that choose to go to McDonald's for lunch, right? Knowingly go to McDonald's for lunch. Why has this got to be any different? It doesn't. So, the conversation will continue. I will tell you that we've just confirmed a resource fair / wellness event at the Narrows Giles football game on September 15th. If your organization, agency wants to be a part of that event, just get in touch with me, let me know. We've got the green light to set up tables, tents, and have a really nice event prior to the game to just help people become aware of resources, opportunities that are out there, connect them with services, just let them know what's going on. So it's a way for us to engage community members and inform them. So if you want to be a part of that event, it's the biggest event in Giles County every year, right? So Friday, September 15th. We'll do that from 5 to 7 that evening, just before the game starts.
And if you have, part of the reason we wanted people to sign in is that as things continue and events and opportunities for technical team participation come up, this is one of the ways we'll distribute information. We'll try to do it lots of other ways, but if you've got your email on there, that will really help us understand. And also continuing with the prevention work with Giles County and the focus group.
Yep.
Everybody wants to be involved in the solution.
Thank you all so much for your time this afternoon.
All right, thanks.
Take care.